I was really circling the drain, and I really felt like I hit the bottom. And from the outside, I looked perfect. I had this amazing husband. I had these great kids. I was in this beautiful home. I had this job. I was married to a doctor. I mean, from the outside, what people saw wasn't what was happening on the inside. And I, at this point, had already lost 2 physician colleagues of 3 to suicide.
Paging Dr. Cook. Paging Dr. Cook. Dr. Cook, you're wanted in the OR. Dr. Cook, you're wanted in the OR.
Welcome to the Prescription for Success podcast with your host, Dr. Randy Cook.
Hello, everyone, and welcome to the Prescription for Success podcast. I'm Dr. Randy Cook, your host, and I want to begin by reminding everyone that our show is a production of MD Coaches, providing leadership and executive coaching for physicians, by physicians, to overcome burnout, transition your career, develop as a leader, or whatever your goal might be. Visit MD Coaches on the web at mymdcoaches.com, because you're not in this alone. After several years as a very successful radiologist, my guest today realized that the stress of her work was declaring itself in the form of some really worrisome physical symptoms. That, in turn, led her to reinvent herself into a highly skilled physician life coach, yoga therapist, meditation teacher, and podcaster who specializes in physician stress management and self-care education. So, let's hear Dr. Robyn Tiger tell her story. What a pleasure it is for me to be speaking with Dr. Robyn Tiger today. Dr. Tiger is beautifully situated out in the hills of western North Carolina. Welcome, Robyn. Thank you so much for being here.
Thank you for having me, Randy. I am a really huge fan of your podcast, and I also want to congratulate you. I understand you have a 2-year anniversary.
That's right.
So congratulations.
Thank you so much for being a listener. We really appreciate that. And I'm really excited about adding you to the list of our guests. If you're a listener, you know that I've had some fascinating people, and I'm confident that you're going to be as well. As you know, we like to start with beginnings. So I'm interested to know when your interest in medicine came into being.
That was a long time ago. I was actually in the 3rd grade, and I remember this so clearly. I don't know, 7 or 8 years old. Mrs. Miller, who was my 3rd grade teacher. Mrs. Miller, if you're listening, thank you.
I bet she's proud.
I hope she's proud, yes. She rolled out this life-size skeleton. And up until then, I thought skeletons were Halloween costumes. I thought that they were Halloween decorations. I didn't actually know that a skeleton made up our infrastructure. It was actually inside our bodies. And I remember, just like it was yesterday, being completely wowed and saying at that moment that I needed to learn more about the human body and that I wanted to be a doctor.
That's interesting. And it persisted, obviously, all throughout your teenage years when you could have been distracted to other things, but you just kept your eye on the ball from that point. Is that right?
Yeah, absolutely.
And then you got your undergraduate degree in or at Muhlenberg College up in the Lehigh Valley area. And by the way, did you grow up in central Pennsylvania or somewhere in Pennsylvania? I never got that.
Yeah, no, I grew up in the suburbs of Philadelphia in a town called Ambler.
And so how'd you find your way to Muhlenberg? How did they get the pick?
Yeah, it's Muhlenberg, like mule.
Oh, I'm so sorry.
It's like from Peter Muhlenberg.
I should have known that. I mean, it's obviously a Germanic word, and I'll bet that U has an umlaut, so Muhlenberg. Okay.
Yeah, we were the mules, proud mules of all mascots, right?
Wow.
We can take that on a positive note. And well, it was about an hour from my home. And back when I was looking for colleges, I knew I wanted to be pre-med, and my parents were pretty strict about wanting me to be within a decent driving distance, not too far. So they looked, within an hour driving range, and we were lucky enough to actually have several schools that were within that range. And I went and saw several of them, interviewed at several of them, and something about Muhlenberg just felt like home. I just knew I loved it. I applied early decision. I got in January of my senior year in high school, and I just sat back and smiled and waited until college started.
I feel a little bit like a kindred spirit. I grew up in Alabama, and as you may be aware, this is really big football country here, and we have two rather large universities that specialize in that. But like you, I was sort of drawn to the small college and the liberal arts. So when you got to Muhlenberg, was it everything that you dreamed?
Yeah, it was just like you said, it was really small. I hadn't experienced too much outside of my home other than a couple small trips here and there with my family. And it felt very cozy. Like I knew from looking at larger schools and smaller schools that for me, a smaller school is where I needed to be. I wanted to know my professors. I wanted them to know who I was. I just wanted that small feeling, but that strong academic experience as well.
I think there is a lot of wisdom in that. So kudos to you for having that kind of wisdom. And I'm going to bet, since you were so committed and so well prepared, that getting into medical school must have been a breeze, right?
That would be no. Because like I mentioned, I hadn't done too much outside of my home. My first year of college, I was let loose. And so I said, I don't have an exam until October. Wow, that's fun. And so I had to learn how to study in a different way. We weren't having quizzes and tests every week. So my first year of college was definitely eye-opening. And there were many individuals I became friends with who went to private schools for high school. And so they were able to actually teach me how to study, so that although my freshman year was very rocky, I came in very strong beginning my sophomore year. But that grade point average from the first year sort of carried over. So even though I actually got a 4.0 almost every semester, starting sophomore year, junior, and senior year, I had some catching up to do. But I did end up getting into medical school, and I was ever so grateful. And I had the same kind of feeling in my medical school that I had in my college, and that had this warm, homey kind of feeling. And I was again drawn to that. But I have to admit that in my sorority house, we had the wall of shame. And all of us put up anything that we didn't get into. All of there's no internet then, right? So they mailed you letters. Yeah. So any pre-law, pre-med, pre-dental, or anybody that was getting anything, anytime we got a rejection letter, we put them up on the wall. And there was one school that actually rejected me that I did not apply to.
Oh my goodness.
So that went right in the middle. But, and we laugh. But my goodness, my sorority sisters and I are still laughing about that wall. And we were all very happy and very successful and in everything that we're doing now. But I have to be honest and share with you.
Yeah, that sounds like such a great idea. All of us who have ever tried to get into any graduate school understand that pressure. And this seems like a way for you and your sorority sisters to get out there and say, look, we're all in this together. All of us are deserving, and we're all going to have different experiences. And it sounds like it must have been a really uplifting and supportive experience for you and everybody else, I guess. Yeah.
Yeah, I was grateful for that. And also it shared that we're not alone. Whoever was applying to wherever, that you're going to hear no's. You're going to hear no's your whole life. And you have to hear a lot of no's before you hear yeses. And so it teaches us, taught us that it's okay. It's okay.
Well, I want to congratulate you and your sorority sisters for having a really good way to, or a good method to get through that sort of mental anguish, because it really is. It really, really is. All of us who've been there know. So once you were there, was medical school everything that you expected, or did you find that avalanche of basic science to be a little intimidating?
Well, definitely it was a lot intimidating in terms of, what we had to learn in what period of time. I mean, biochemistry in college, wow, we learned the Krebs cycle. It took a whole month. We did it in one lecture in medical school, right?
Yeah.
So definitely warp speed ahead. And there was a tremendous amount of information. And there's this very fine line between I'm so hungry, I want to learn it all. This is all so amazing. And wow, this is really, really hard. Like, how am I going to get through all this? I happened to have a really wonderful class. I really loved my classmates in general. We had a wonderful core group of students, of friends, many of whom I'm friends with many, many decades later. We just had our 30-year med school reunion, which I actually co-chaired virtually a couple months ago. And it just feels like yesterday that I'd seen them all. So I was very fortunate in that way.
And at about what point in your medical education did you start to think about radiology?
That wasn't until late. So I felt like a kid in a candy shop. Every rotation I did, wow, that's really cool. No, that's really cool. No, I really like that. And I didn't know. The whole third year went by, which, as you know, that's when you get to taste most of the areas of medicine, the general areas. And I was going into my last year and I still said, oh my goodness, what am I going to do? How am I going to figure this out? We have to, start applying and get ready for the match and all of that. And there was a book at the library, this little paperback book that a librarian in my med school recommended. And I wish I remember the name of it, but the gist of the book was that they had interviewed physicians from many, many different specialties and asked them very specific questions. And the questions had to do with basically, like, what do you want your life to be like? Of course, there was finance involved, how many hours of work, the kinds of things. Do you like working with your hands? Do you like collaborating? Are you better working alone? All these kinds of questions. And at the end, you get a score and you get to look up all of the different types of physician specialties and see where you fit in the most. And I found that fascinating.
It is fascinating.
And I found myself loving surgery. And I actually had a lot of similarities with the surgeons. Radiology was up there. So I was really thinking, I'm going to be a surgeon. I love working with my hands. I love the general surgery, just getting in there. I love the trauma. I was at a trauma center. And I was on call one night in my 4th year as a medical student. And I was rotating through radiology at that time. And I remember the surgeons coming down and they were going over this trauma case. And the surgical resident, who was female, said, if you can just hold on for 1 second, my husband's paging me. Now, we didn't have cell phones then. Okay, so my husband's paging me. I need to call my husband. And she picked up the phone that had a cord to it. And she called her husband. And I hear her on the phone saying goodnight to her kids. And she started to cry. She started to cry. So now I'm sitting there. We're looking at this CAT scan of this level 1 trauma and the multiple gunshot wounds. And we're trying to figure out which bullets are the new ones and which bullets are the old ones. And do they have to go to the OR? And we're playing that game because that's the game we play in trauma. And she's crying on the phone saying goodnight to her kids. I was single at the time. I had a boyfriend, but I wasn't married. I didn't have any of the responsibilities except to myself. And I just had this aha moment like, whoa, how do I want the rest of my life to be? And what do I want to be like that? Would that how my whole life is going to be? Like that, crying, talking to my kids on the phone, my someday kids. So I really had to think about it. And there are multiple subspecialties of surgery where you would have a more regulated schedule, but that wasn't what interested me. I liked the, the kind of surgery that probably wouldn't change in terms of my lifestyle. So I really had to think about it. And I found myself really enjoying my rotation in radiology. It was a way for me to know about all different types of illnesses and diseases, all different types of ages, all different types of specialties. I wasn't really pigeonholed into one thing. And I loved being able to see the insides of people. I thought it was so amazing to be able to figure out what was wrong with somebody, kind of being the doctor's doctor.
Yeah.
And I was talking to a good friend of mine, and she said, well, I'm going into radiology. I said, really? And so we had a heart to heart. And when I realized that there was also this whole interventional component where you could do procedures. I mean, it wasn't general surgery, but I'd still get to work with my hands. I said, I think I found the specialty that would allow me all the things that I'm interested in right now. And so that's how it came to be.
That is an incredible story of incredible insight, I think, and how appropriate it is that you got the message to pick what you picked by observing another female who was doing what you thought you wanted to do. And based on that, you decided maybe this is not going to be the best choice. Is that basically the way it unfolded?
Yeah. I can still feel the room. I can still see the alternator where we actually hung films. We had films then.
Yeah.
And just sitting there and feeling her pain. And, whether you're a male doctor, female doctor, whatever, it isn't necessarily just gender. It's how do you see yourself? What does a day in the life of you look like? And a day in the life of me was that I was going to be home at night, saying goodnight to my kids. So that I didn't have yet, but that I wanted.
Yeah.
Yeah.
It's a great story. And I really appreciate you sharing that with us. Once you got into your residency, did you feel like, yep, this is exactly where I belong? Or did you ever have any second thoughts?
Yeah, well, again, in Kid in the Candy Shop, I loved everything, but I did enjoy all the technology that just kept growing and growing. And
boy, it really did, didn't it?
It was just unbelievable. I mean, just in this, the period of time from residency to practicing radiology, I couldn't get over it. I mean, my husband, who's a radiologist, and he's 4 years older than me, he was still doing venograms to look for blood clots. And by the time 4 years later, I was in my residency, we were doing ultrasound to look for blood clots. We weren't putting needles in people's veins and shooting dye and looking that way. So just MRI, CAT scan, everything, just amazing. Yeah.
It's an awful thing for the interviewer to share his own personal stories, but I'm going to.
Okay.
When I was in my surgery residency, and obviously I go way back further than you, but we were on our way through the radiology, but the whole team was on our way through the radiology department to go over the films of the day like we always did. And we walked by a little cubicle with a curtain drawn over it, and our attending who was with us stopped us and turned us around, and he took us over there and he introduced us to this person who was glued to a little oscilloscope, and it had these little just waveforms jumping up and down on there. There was a patient in the room with him, and he had this little probe that he was rolling over the belly. And so the conversation ensued. Our attending introduced the guy, and he was a PhD in electrical engineering or something, and he was a fourth-year medical student. And he was using A-mode ultrasound at the time, and he was rolling this thing around, and he'd point up there and he'd say, see those little squiggles? Those are gallstones. And this is going to take over the world of intra-abdominal imaging. And every one of us to a person, except for our attending, said, ha, ha, ha. You got to be kidding us. And the rest, as they say, is history. At that time, we didn't even have CT imaging of the brain, which was the first to come along, and how it exploded from there and how it grew. And you actually got to live through that progression of technology. So I apologize for my long and windy story, but I guess what I'm getting at is that must have been incredibly exciting for you to work.
Yeah, it really was very exciting. And to see the advancement, I mean, the first CAT scans that we had were, now I think about it, my goodness, they were like very pixely, not so clear. Year after year, technology got better and better. I mean, mammograms were on these pieces of paper with blue ink that came off on your fingers. And now we have, 3-dimensional breast imaging and, MRIs are just everything's so crisp and clear. It's just so amazing to see what's happened in the last several decades.
So it sounds like going into your radiology training, you were very satisfied with your choice, but I'm curious, understanding the number of new technologies that developed in imaging over the next few years, did you have any strong feelings about whether you wanted to be a generalist or whether you wanted to be a more of an interventionalist, or what exactly was in your head at that point?
I really enjoyed the procedures. They got me really excited to be able to work with my hands and to see some effects and changes, right away in whatever I was doing. And I was good at it. It was something that I was really good at. And I was in my residency at a really interesting time. My husband, who I mentioned was 4 years ahead of me, I remember sitting on the floor of his apartment with a typewriter, like an actual typewriter, with the eraser tape,
With a ribbon,
ribbon, and you push the backspace and it erases the letter, or just puts a big white blob over the letter that you messed up. Yeah. And I had typed all of his fellowship applications for him. At that time, fellowships were, maybe I want to learn something more. But there really wasn't a requirement or an expectation that you weren't going to go out and do any type of extra training. He was between getting a job and doing a fellowship, and he ended up taking a job. 4 years later, by the time I was looking, fellowships really became something that was expected, something that it would be hard to get a job without having some additional training.
You're going to have to spend some more time, yeah.
Yeah, I was going to have to spend some more time. And I had gone back and forth about the different areas. Again, I liked a lot of things, but body imaging was something that I was really interested in, diving deeper into MRI and CT and ultrasound of the body. And I spent a fellowship year at Thomas Jefferson University Hospital in Philadelphia doing just that. It was really an amazing year. Now, this was my first year in a big place. I talked before about loving that hometown feeling in the smaller programs. And here I am in the city in Philadelphia.
Different way of life.
Whoa, a different way of life. And I'll tell you that, we start July 1st, right? As fellows, that's our academic year. And I was on call July 4th, so 3 days into my fellowship.
Oh, my goodness.
And I could not find my way around inside the hospital, but I knew how all the buildings connected outside. So the whole night on call, I was going outside to come inside and outside to come inside so that I could get to CAT scan, which was on the 7th floor of this building. And, this was on the 3rd floor of that building. And MRI was over here and ultrasound was over there. And it wasn't just one hallway anymore. It was just this vast city of a building. And I remember in between, as I'm coming out in between buildings on call, getting paged to all the different areas, different departments, I thought what I heard were gunshots, and I got terrified because I was in the city. But actually, it was just the fireworks because it was July 4th. So I'm like covering my head and cranking down my body, and I still remember laughing to myself. But that was my first experience in a major hospital system in a city in a really big place.
Hi, I'm Rhonda Crow, founder and CEO for MD Coaches. Here on RX for Success, we interview a lot of great medical professionals on how they grew their careers, how they overcame challenges, and how they handle day-to-day work. I really hope you're getting a lot of great information. But if you're looking for an answer to a specific problem, management or administration challenge, or if you're feeling just a bit burnt out, like maybe you chose the wrong career, well, then there's a faster way to get the help you need. No, it's not counseling, it's coaching. RX for Success is produced by MD Coaches, a team of physicians who have been where you are. I know you're used to going it alone, but you don't have to. Get the support you need today. Visit us at mymdcoaches.com to schedule your complimentary consultation. Again, that's mymdcoaches.com, because you're not in this alone.
We'll get back to our interview in just a moment, but right now I want to tell you a little bit about Physician Outlook. If you haven't discovered this remarkable magazine, please do so very soon. It was created by physicians, for physicians, to showcase the intersection between clinical and non-clinical interests, whether it's writing, painting, cooking, politics, and dozens of other topics, Physician Outlook gives a physician perspective. It's available online and in print. It's really unique among physician lifestyle magazines. And like the Prescription for Success podcast, Physician Outlook amplifies the voice of any physician who has something to say. It also engages patients who still believe in physician-led, team-based care. And Prescription for Success listeners can get 3 months free when you enter our promo code RX for Success and select the monthly option at checkout. That's a really great deal on this stunning publication. And now let's get back to today's interview. What's next at that point? I mean, is your husband still training, or are you guys going to private practice? What's happening at this stage of your career?
Yeah, so as I mentioned, he was 4 years ahead of me, so he was already in practice.
I see.
Yeah, so my first year as a radiology resident was his first year as an attending. And he was in a practice in South Jersey, and I was in residency and fellowship in Pennsylvania. And so we were driving in opposite directions, living in New Jersey, closer to Philly. And,
What fun.
Yeah, it was.
You're pregnant.
Yeah, I was pregnant, and yeah, but you do it. And you just do it. You take call, you do it all. It was actually still a really, really wonderful time in our lives.
I bet it was.
Yeah. And again, I told you the story about the surgery resident who was crying on the phone to her child saying goodnight. I had a similar experience in my fellowship. Nobody was crying, but I met the most amazing female radiologists at Jefferson who were my attendings. And they were working part-time and job sharing, which I had never even heard of. Because here I am now, pregnant with my first child and thinking, my husband is full-time radiologist. We don't live near any family. What am I going to do? And it opened my eyes to the possibility of being able to be a mom at home some days and be able to work some days. And so I had this aha moment while in my fellowship at Jefferson with these very esteemed attendings who were moms and were doing both. So that was my introduction into, okay, how can I find a job where I can do what they're doing?
Well, now that's a big turnaround, and I want to hear some more about this. Now, was this the only such female role model that you encountered at that stage of your development, or did you see others?
Well, I had some female role model attendings in my residency who I adored, but they were full-time. So I didn't even know that this was an option, and I hadn't really thought about it. I mean, I pretty much had a straight route: college, med school, internship, residency, fellowship, job. There wasn't really any thinking time, and the
you have a
marriage
tendency to just not even look from one side to the other. You just keep going, right?
I just kept going. And I knew that I wanted to wait until I passed my boards as a resident to begin to try to have a child. That was actually very important to me because there was a female resident when I was in my residency that was there before me, and she was still there after me. And she was on her 4th child when I was leaving. And she had worked out some deal with the dean and the chairman that she would finish when she finished. And I commend her because that was her choice. But I knew that I wanted to get my boards behind me, pass my boards, and then, move forward. So that's why we had our first child in my fellowship, despite us being married several years. And then I said, okay, now what does my life look like? I have to keep reassessing. What does a day in the life of me look like? How will I feel fulfilled? What will be the right choice? And during my fellowship, I squished all my call into the first 75% of my fellowship, which meant I was taking call 2 to 3 days a week, pregnant, doing 2 to 3 36-hour shifts a week, working 6 to 7 days a week. And I was pretty sick. I had a hep block. I had IV running, fluids running all the time because I was one of those pretty sick pregnant people.
Right. Goodness.
But I knew that I wanted to be home with my baby. My baby was born, he was going to be due in April of my fellowship year. And I didn't want to be taking call after he was born. And so that was another sort of, view of, okay, well, now what's my life going to look like? And having these role models at Jefferson, one of the most esteemed institutions, really gave me the courage and the insight to follow in their tracks and find a job that worked for our family.
Well, tell us about that. What was the job that worked for you and your family?
Yeah, well, one of my attendings at Jefferson had a very good friend that was in a very large, progressive private practice in South Jersey, which was like pretty close to our home. And if you remember, my husband was driving over an hour each way back and forth to his job. And he, made a phone call because that's what we did. There was, again, no internet. There was no nothing. And I got an interview and I met with this practice, and they were as academic as you can be, but private. So very, very progressive. And I was very impressed. And they had a female radiologist. They already had a pair of female radiologists that were job sharing. Basically, they didn't care who showed up or when, but someone had to show up. So it didn't put them out at all because there was at least one human being that was in that spot, doing those cases, reading those films, doing the procedures on any given day. And they had another female radiologist who was already working, and they wanted to pair us up. And so I got into a position where I was able to find that job where I could divide a few days at home and a few days at work. And that's the job that I took first.
And it worked out very well for you?
Yeah, it worked out great for me. Yep, in the beginning, it worked out great for me. I was there about 7.5-ish years. And, the drive for me started to get to be rough because at some point during my working there, my husband's practice really wanted him to move closer to where they were. So we did end up moving closer to his job, which meant then I was doing the commuting. And that became very difficult, especially because then I became pregnant with our child number 2.
Right.
So after several years of that commuting, I decided that it was just too much. I was making some silly mistakes, things like, we were supposed to be on US Air flying on a family vacation, and, my sister-in-law wasn't there yet with the kids. And I called her and said, hey, don't worry, the plane's late. And she says, where are you? We're boarding. So I had us in the wrong terminal because I was so exhausted. And I had us showing up for a show one time. We went on a Sunday to see a concert with the kids. And I said to the usher, can you give me a hand? The people are sitting there in our seats. He's like, no problem. I'll take care of it. And then he came back and said, I'm sorry to tell you this, but your show was yesterday. So as you can imagine here, I'm getting very, very tired, exhausted. I'm starting to screw things up. I'm just like, messing up the kids' backpacks, confusing the lunches. And I got concerned that this was going to take a toll on my work and my ability to make those life and death decisions that was my ultimate responsibility. So I decided to take the carrot that my husband's practice had been putting in front of my face for many years, and I ended up joining his practice, which was much closer to our home and decreased my commute by a gazillion and made it much easier for us in terms of that. It was hard to leave that first practice. I loved it. I had some amazing colleagues, particularly female docs that I adored, and it was mine. I wasn't anybody's wife. It was my practice, but the compromise was, that it was best for our family. And so I took job number 2, which was closer to our home.
What if that other job had not involved the long commute? Do you think it would have changed things materially or not?
I loved having my own space, and I loved being my own person, and I loved having my own name. It got confusing when I joined my husband's practice, and they ended up calling us She Tiger and He Tiger because it got very confusing, Dr. Tiger, and which Dr. Tiger? And
how quaint.
Yes, and he had been there for several years, and he was partner, and then his wife comes along, and there was a lot of, I had to prove myself, to, really, and I felt like I was actually proving myself a lot for many years.
Yeah.
I really enjoyed having my own space. I thought it was very healthy for our marriage as well. So even if I had both of those choices from the beginning and they were equidistant from my home, I probably would have chosen the job that I had chosen first.
I guess what I was trying to get at it is sort of a backhanded way and to try to avoid leading questions. But one of the things that really struck me as I was perusing your website is that you say that you're going to tell the story of your burnout journey and how you saved your own life. And I think what I'm trying to get at is where would you pinpoint the beginning of your burnout journey?
It was a long haul. I think that the stresses begin back in medical school, even when we don't realize it. And the stress and the anxiety, the exhaustion, and that just tumbles into the internship and the residency and the fellowship and the actual job. But when I really became aware of what was going on was first when I realized I had to change jobs, when I was making mistakes that luckily weren't life-threatening. And then what happened after I was in my second job for several years, I started to develop several illnesses, and I became what we as physicians don't ever want to become, which is an interesting case. I think we love interesting cases because we love the intellectual stimulation of trying to figure them out in a multidisciplinary approach, but you don't ever want to be that interesting case. And that is what I became. And I'll share with you from the top down what was going on. I developed migraine headaches with intractable vomiting. I had never had a migraine in my life. I had vertigo and tinnitus that would keep me awake at night. I had bleeding gums, burning gastroesophageal reflux, digestion was poor, always abdominal distension. I had diarrhea, constipation on any given day. I developed pain in my body, in my joints, my neck, my shoulders, my back, my hips, and these intermittent paresthesias where I would feel numbness in my hands and my feet, and that would come up at the most inopportune moments. For example, during a breast biopsy, where I would have the biopsy gun right at the lesion and I'd just be stuck there because I couldn't feel my hands to pull the trigger on the gun. And my tech would say, "Hey," like looking at me like, "What are you doing? Dr. Tiger, you're right there at the lesion. Good job, Dr. Tiger, you're right there." Like basically, like, why are you not doing anything? We're kind of laughing about it here, but the truth was that I couldn't, I had to wait for it to pass. And of course, what did I think? I thought I had some debilitating neurologic disease, because what else would be causing this craziness?
Of course.
And I went to all kinds of doctors. I sought out our colleagues. I had my internist on board, gastroenterologist. I saw a neurologist. I went a periodontist. And I also started to have some really, really dark thoughts. Like I don't even know if I want to be here anymore. Like it was that bad. And I had, fears. Like this is really scary. No one knows what's the matter with me. I sought mental health care help. I was on lots of different pills. I had, of course, as a radiologist, I was getting imaged, right? I popped on the MRI. What's the matter with my hip?
doubt.
What's the matter with my shoulder? What's the matter with my back? Of course, as you can guess, nothing. They were all negative. And I had a choice to make. I was really circling the drain, and I really felt like I hit the bottom. And from the outside, I looked perfect. I had this amazing husband. I had these great kids. I was in this beautiful home. I had this job. I was married to a doctor. I mean, from the outside, what people saw wasn't what was happening on the inside. And I, at this point, had already lost 2 physician colleagues of 3 to suicide.
Oh, my goodness.
I lost someone from my residency when I was in my fellowship. And actually, she had called me 2 weeks before she died and asked me if I could get permission from my attendings for her to shadow me at Jefferson, because she was interested in my fellowship. She had done an interventional fellowship. She wasn't sure if she wanted to do a body fellowship, and I got permission. And she was supposed to come and sit with me for a week. And 2 weeks after that phone call, she overdosed.
Oh, my.
The second time was in my first job. The kindest radiologist the only radiologist in that entire practice to call me the day I returned from having my second child to ask me if I was okay, knowing how difficult that would be. He was such a kind man, and he overdosed on a retreat that the practice was having. So I already had the two of them in the forefront of my mind, and I was seeing myself going down that path. And I said, I've got to figure this out. I have to save my own life because no one else is going to do this for me. And that's what I did. So I started researching, okay, well, what else is out there? None of the doctors in my life can help me. I'm this interesting case, but they can't help me. No one knows what's the matter with me. And I started hearing more and more talk, whether it be the media, whether it be what I was reading, watching on TV and the news, about things like yoga, things like meditation. And Randy, I was and still am a gym rat. I thought that stuff was like for those people all the way over there. And I had all of these preconceived notions as to what that stuff was about. And I had never dabbled in it. One year I saw this advertisement for a Yoga 101 class down the road from my house, and it was around New Year's. And I talked to my neighbor who's a nurse, and I said, hey, you want to get out of the house and see what this is about? She said, yes. And I said, if it's terrible, we'll just go out to dinner. And she said, okay. So that was my baby step, dipping my big toe into something outside traditional Western medicine. And that's what I did. So after that very first class, I remembered feeling this unbelievable shift in how I was feeling.
So it was right then and there, huh?
It was right at the end of the class. It was what I liked about it was informal. You could ask questions, but she took us through a class and I just felt calm. Like I didn't even want to get up off the floor. And I felt very clear. I wasn't tired. I was calm. And it was just this clarity. And I thought, what is going on with this? This is unbelievable. I remember driving home and I'm like, am I dreaming this? Did this really happen? How could I have had this shift so quickly? And I continued with that 101 series and I continued taking classes. And I noticed little by little, one by one, that all of the symptoms that I described to you disappeared. Everything. No pills. Nothing at all. No talk therapy. Nothing helped except what I was doing for myself, which I came to understand that the diagnosis that nobody made was the most important diagnosis that I ever made in my life. And that was that I was suffering from chronic stress. And once I learned how to regulate my own physiology, once I learned how to decrease the stress response and increase the relaxation response, work with my own autonomic nervous system, and work with my thoughts, I was able to relieve all the symptoms that I was feeling, down to those pretty negative thoughts.
So it sounds like that was undoubtedly the foundational moment for what would become StressFreeMD. Am I correct?
Yes, and it was a decade of personal growth and education and experience that brought me to where I am right now.
So how much longer were you in practice once you began to have a clearer understanding of what was going on with your physiology?
Yeah, it was a few more years. It was a few more years in practice. Because I remember my staff being like, Dr. Tiger, what is going on with you? It is so great to be around you. Or we are so glad you're scheduled here today. Oh, you make us feel so calm and so happy. We love being around you. I mean, it was interesting to see how palpable my change was with respect to the people around me. And that was a few years that, after I started noticing the changes. But the stresses of medicine didn't change. It was just my ability to be with the stresses, to be calm in the chaos of what was surrounding me.
That must have been significantly gratifying to you to see that just by what had happened to you was apparently having an effect on other people. Am I reading that correctly?
Yeah. I mean, my house became the calm house. My kids' friends wanted to be around me all the time. They came over even when my kids weren't there. They just wanted to be in my home. And they wanted me to teach them the stuff that I, was learning to help myself, and
What a great
I began
story.
doing that. Yeah.
And so how long was it after that you decided that it was time to leave the practice and and be a full timer in this new glorious world that you had discovered?
Well, as I mentioned, I was able to feel better with what was going on, but did not have job satisfaction for many years. It became really a hamster on a wheel. RVUs were the most important thing since I was
That was a
doing.
big question for me, and I have always wondered
Mhm.
if radiologists felt the incredible oppressiveness
Mhm.
of reimbursement for services rendered that we felt in the other specialties. And it sounds like that's exactly what happened.
That's exactly what happened. So I went from being in a reading room with view boxes all around me and radiologists at every view box and this very gregarious, intellectually stimulating type of job where we were asking each other questions and showing each other cases, and all the different teams came down when we were in the hospital to go over all the cases, and you knew every patient really well, to sitting in a dark room by myself, looking at a computer, dictating with a voice activated transcription into a dictaphone 9+ hours a day, very isolating. And that was not what I signed up for. And what happened was over time, we started getting, these expectations as to, how many RVUs you should be pumping out. And so, for example, if I was doing breast biopsies on a day and I speak with the patient before the biopsy, I do the biopsy, I speak with the patient after the biopsy, I call the patient's doctor after the biopsy, I'll call the patient later that day to check up on her. The only thing I get paid for is the biopsy.
Yep.
Whereas the gentleman or the female, whoever, gender, all genders aside, the person sitting in front of that computer dictating MRIs for the same 9+ hours a day, it looks like they are bringing in more money to the practice because they're generating so many RVUs and they're not
Yep.
talking to anybody except their dictaphone.
Right.
And I wanted to be the kind of doctor that was talking to the patient and talking to the referring clinicians and making the follow-up calls. And so it became very difficult. Also, when you were put on rotations where the specific types of imaging studies you were told to read on that day did not generate the RVUs that other imaging studies did. You weren't told to, you were just put there. And so it was so much pressure that it looked as if you weren't, pulling your weight on your job. And in essence, if I did a breast biopsy and I was really kind to that patient and that patient had a really good experience, they're going to go get that MRI that other doctor is going to read because they're going to come back to the practice. But it wasn't really seen like that. And I just wasn't having that job satisfaction. It became talking myself every morning into getting up and going in like, oh, another day of this. Oh, how many more days of this? And I just was very, very unhappy. And I had started working with a coach at that point to find out what else can I do. A physician friend of mine from medical school who had made the move into pharma had connected me with this other physician who actually had a business helping physicians find non-clinical positions. And so I was dabbling in that. Do I want another radiology job? Do I not want to work in medicine anymore? Do I want to add something else to my life? Like, what can I do? What will be fulfilling? That was where I had that conundrum. And the practice actually made the decision for me. So here I was, recognizing that there's these other things that are really helping me. People are asking me to help them. And I wasn't having job satisfaction. And the practice lost a hospital contract, which meant they had 5 doctors, full-time physicians, too many. And so there were a few of us who were part-time because, as I had mentioned earlier, I worked part-time and I worked part-time in the second job as well. And so the part-timers did not have their contracts renewed. It wasn't anything except a business decision.
Sure.
Initially, of course, it was a blow. I won't lie. I have my doctor ego. but it gave me the opportunity to sit back. And there were other job opportunities available. And I had to say, do I want to make a lateral move and do what I'm doing now? Or do I want to take everything I've learned and implement it to help other people. And I chose the latter because I knew that if I took another radiology position, I wouldn't be able to educate myself and get the certifications that I needed and get the experience that I needed to help other people in the way that I wanted to.
When I hear you describe this, it's actually heart-wrenching. And it makes me think this focus on RVUs in any physician that's practicing now or within the past probably 10 years is aware that is more or less where it's at. But if you look a little into history and how America became so great because of the perfection of mass production, first at Ford Motor Company and then everywhere. You're describing the same sort of thing. You have an individual do the same task repeatedly and consistently because that is the most efficient thing for creating a product. But if you are a physician, if you are someone who is inclined to become a physician, you're not going to get any satisfaction out of that. And frankly, I think in the world of mass production, they discovered that it didn't work very well for automobile manufacturers either. They had people putting monkey wrenches into the doors so there'd be a mysterious rattle and things of that nature. But my point is, and what I'd like for you to comment on is what that type of enforced, task-oriented, revenue-focused behavior does to the soul of not just physicians, but any human being.
It really compromises your integrity, and to be asked to not perform at your best, to not be able to do your best job, in medicine, to not be able to, take that extra few minutes to make that call, to compare to a prior study, to make sure that whatever you're diagnosing in radiology on that image was or wasn't there before, grew or didn't grow. People were cutting corners. People weren't doing the jobs they should have been doing. And I ended up picking up a lot of the pieces. And what ended up happening was so many of the doctors would come and side me. Hey, can you please take a look at this? I don't think this is right. I don't think this person read this correctly, or so-and-so dictated this case, but they didn't even mention that there were 3 prior studies, going back 5 years, or, they would bring me their own family's images. They bring me their own personal images. They trusted me, because I took that extra time. And, when this happened to me, when that job decision came down, I can't tell you, I had a cardiothoracic surgeon in my office crying because he respected me that much that he couldn't believe that the practice would do this over finances and that they were keeping the physicians that weren't as competent. And I'm not mentioning any names and I'm not patting myself on the back, but I will say that I was very good at my job and I cared very much. And it showed because my colleagues highly respected me. But I was being asked to perform in a way that did not agree with, how I believed that I should be working. It went against everything I believed.
Well, it's easy to understand why you would feel like you couldn't continue to do that. I just, as I listen, it's really kind of heartbreaking for me to hear what you've been through and so many other people have been through. Many times they don't even know what's happening to them. But it is obviously epidemic in this world of healthcare delivery. I want to ask you to comment on just one other thing before we get into your personal prescriptions for success, and that is something else that I mentioned that I spotted in your website. You mentioned gaps in medical education, and I want to hear a little bit more about what that means, and do you think if we plug those gaps, we might have some chance at turning this thing around?
Yes. I would love nothing more than to make self-care education intracurricular beginning day one of medical school. In 2016, there was an article in JAMA, Journal of the American Medical Association, that I came upon that was really horrifying. And what it showed was that 1 in 4 medical students experience depression or have depressive symptoms, and 11% of medical students have suicidal thoughts, and 15% of affected students seek professional help, which means 85% of medical students that are suffering are not getting professional help. These statistics are astounding, and they tell us that we have issues beginning in medical school. And I truly believe that they probably begin even earlier with stress and anxiety, knowing what colleges are reporting and so on. But if we could make self-care intracurricular, if we could teach medical students, how to control their own physiology, how to work with their thoughts, how to improve their own well-being, not only will they be better for it, but their patients will be better for it. And I would love nothing more than to be able to be that person to make that happen.
Well, it sounds like you're making some pretty good progress. One other thing that I would like for you to touch on before we move along, you mentioned earlier in our conversation when somebody brought up the possibility of yoga that it seemed like such a notion that was so far from the mentality where you lived.
Mm-hmm.
Give us your capsulized version of what yoga is all about and why we could all benefit from it.
Right. So I put my doctor hat on because when all of this was happening and I was starting to sense these shifts, I needed to understand the physiology because my left brain was saying, whoa, what's going on here? And from one physician to other physicians, I understand how doctors think, right? So we need to understand the why behind what's happening. And what I've come to understand is that our autonomic nervous system, which is our sympathetic and parasympathetic divisions, responsible for our stress response and our relaxation response, should be creating homeostasis at all times. And that our acute stress response, we want that to work, right? We want our muscles to tense up. We want our alertness to be on high. We want our heart rate to go up. We want sugars and fats to mobilize for that immediate energy. And what's also happening there is our digestion and our immune systems shut off to give more energy and more attention to the parts of our body that are needed. But the problem is this chronic stress. And chronic stress, when that's going on, the same exact things are happening. So our brain doesn't know the difference between something that words are just creating in our brain, just words are happening where our brain's telling us things that aren't true most of the time. The same things are going on. We are tensing up our muscles. Sugars and fats are being mobilized for immediate energy. Our heart rate's going up, blood pressure's going up, digestion shuts off, immune system shuts off. And over time, that makes us really, really sick. And chronic stress is associated for those reasons with heart disease, stroke, diabetes, cancer progression and growth, and even decreased longevity. Research is showing that our telomeres, these protective ends of our chromosomes, prematurely shorten with chronic stress, which means we live shorter lives when we're under chronic stress. So that's how this is related to illness. Now, the physiology piece is when we understand how to work with our breath, knowing that, for example, when we inhale, our heart rate goes up, when we exhale, our heart rate goes down. When we breathe into our chest, that's stressful breathing, breathing into our belly. We increase vagal tone, that's parasympathetic response, that's relaxation breathing, calming breathing. So simply working with your breath, knowing how to increase your exhale length, knowing how to breathe deeper into your body will take over, hijack your stress response and allow your relaxation response to kick in. Moving in a certain way, moving your body in a certain way, understanding how to increase the resting length of chronically tense muscles, that comes again with something called somatics now. So moving through somatics, and it's a different type of movement, working with meditation, learning how to meditate. And there's so many different flavors. Docs are super busy, so I provide guided meditation, and I'm certified in a specific type called iRest. And research has shown that people who meditate thicken their cerebral cortex. That's the CEO of our brains that's making very important decisions, right? Shrinks the amygdala, our trauma centers, and thickens our hippocampus, new memories. Right? So we can improve so many things in our brain simply with adding meditation. And then life coaching, which helps us work with our thoughts. So it's a combination for me of teaching individuals how to work with their own physiology, going back to the basics of the autonomic nervous system, learning how to hijack our stress response, and working with our thoughts, understanding how to work with our thoughts, because it's our thoughts that determine how we feel, how we show up, and the results that we create in our life. And that is what I do. I teach others to do just that. And yeah, I thought yoga was turning upside down, twisting your body, standing on your head, saying weird things, listening to weird music, wearing strange clothes. And, I work with military veterans. I work with SWAT teams, firefighters, police officers. I work with a lot of different populations that think that too. And at the end of some of those workshops, I get marriage proposals because they too learn how to work with the physiology. So I put my doctor hat on when I like to explain these things, because it really is about how our body works and learning how to work with what we've got. We learn a lot of anatomy and physiology, but we don't learn how to utilize and how to work with it. And that's what I teach.
What's really fascinating to me about this discussion is how you went through the experience of having some unquestionably real symptoms that were clear signs of pathology somewhere, and nobody could figure it out. It couldn't be seen or palpated or heard or any of the other modalities of physical examination. It couldn't be found on any imaging technique. It couldn't be reflected in any tissue biopsy, but yet there was something wrong with your physiology that improved when, like you say, you learned to control your own physiology. And I think it's just absolutely fascinating, and I'm so grateful that you took the time to be with us today and enlarge not only my knowledge, but the knowledge of our listeners. And I'll bet that this is going to turn out to be a really good thing for somebody that hears this podcast. And I bet you'll hear from them in the process as well. So thank you for spending the time with us today. What I want to do at this point, Robyn, is give you an opportunity to just take over the podium. This is the part of the program that gave us our title. So I'll close my mic for a moment and listen carefully, everyone. Dr. Robyn Tiger is going to give us her prescriptions for success.
Thank you, Randy. I'd first just like to define success. Most people, when you think about that, think about financial success. And I think of success as being, what if I left all the money and possessions aside? What if they all disappeared? Then asking the question, who are you? Who are you without those things? And how do you feel about you? And do you feel successful as just you alone? So with that definition of success, my 3 prescriptions are: first, don't worry so much. Stop with the shoulda, coulda, wouldas, and the what ifs. That keeps you totally stuck and not moving forward. You can't change the past, and all you really have is this very moment right here. So be 100% present and vested in this moment. And I love the quote from Ferris Bueller. It's one of my favorites of all time movies. And he says, life moves pretty fast. If you don't stop and look around once in a while, you could miss it. So prescription number 1 is stop obsessing about the past and focus on the here and now. Don't miss what's right in front of you. All right, prescription number 2. Chronic stress can make you sick. I'm a perfect example of that. I gave all of those situations and all of those illnesses and everything I was feeling physiologically in my body and my mind. The medical literature is chock full of research proving just that. Self-care is not selfish. It's not a luxury. Think of it as a necessity for your well-being. Practice what we never learned in medical school, how to take care of you. And that includes sleep. Don't be a sleep cheat. Sleep is actually medicine. That includes also saying no. Learning how to say no, because saying no is saying yes to yourself. And you don't have to say yes to everything. So prescription number 2 is to be your own best friend and to take care of you. And prescription number 3 is you do you. There's only one unique you. There's never been and never will be another you. So embrace it. Don't live your life and make life decisions based on the expectations of others and what others think you should be, or what others think you should do, what others think you should have. Don't be afraid to get out of the box that you might feel you're in and break down those walls. And like what Ralph Waldo Emerson says, go where there is no path and leave a trail. So prescription number 3 is be the example of what is possible and just be you. And those are my 3 prescriptions for success.
Robyn, thank you so much for sharing with us today. It has really been a great pleasure to have a conversation with you. Before we get out of here, I want to give you an opportunity to tell everybody where they can find the StressFreeMD and all of the things that go along with us. So what do you got for us?
Yes, you can find me at StressFreeMD.net. That's my website. On my website, you will find information about my podcast, which is called the StressFreeMD Podcast, where I share short, stress-free snacks, the 15 minutes or less, and I have special guests, usually physicians, once a month. I'll have the pleasure and honor of Dr. Cook coming on my podcast as well, so make sure you listen up for that. I have several programs that are CME accredited. RX Inner Peace, a physician's guide for self-care, is accredited for 25 CME, and that includes online learning as well as live group and private coaching. And I have 6 other programs that are accredited for nurses, nurse practitioners, and PAs, and open to the entire public. And you can sign up for a free 30-minute stress relief strategy call if you're a physician and you're looking to learn more and you want to move forward in your life and learn how to control your physiology and your mindset. I'm happy to chat with you. And there are free videos. So check out my free self-care videos. There's a breathing tool, there's a release for your neck and shoulders, and a guided meditation. So all of those things are on StressFreeMD.net. And you can follow me on Instagram at StressFreeMD, LinkedIn at Robyn Tiger MD, and at the StressFreeMD website. I'm sorry, Facebook. Okay, those are all the things.
Outstanding. And I'll just throw in, make sure you go to StressFreeMD.net if you want to send an email.
You can reach me there too.
Don't mess it up like I did with StressFreeMD.com.
Yeah, I'm .net. I'm .net. And one more thing, I also have a physicians Facebook group called the Physician Self-Care Community. So if you're a physician, come join us, and we'd love to have you.
Dr. Robyn Tiger, thank you so much for being with us. It's been a pleasure.
Thank you so much, Randy. Thank you, Dr. Cook.
Thank you so much for joining us today. And remember, you can get more information about our guests and hear them face my rapid-fire questions at our Patreon site. And while you're there, you can subscribe to the podcast, give us a rating, and hopefully offer suggestions on what you'd like to hear in future episodes. Thanks very much to Ryan Jones, who composed and performs our theme music. That'll wrap it up for now, so be sure and fill your prescription for success with my next episode.